You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you have type 2 diabetes or have been told you're pre-diabetic. With us, we have Dr. Carter. Dr. Carter, welcome to the program.
Thanks so much. Good to be here.
Now, before we get into today's topic, a little bit about your center, because I know you do more than diabetes treatments. Tell me a little bit about the center.
We do. I'm at Integrative Health of Philadelphia. We work with type 2 diabetics, hypothyroid patients, as well as patients who are suffering from peripheral neuropathy. So we use an integrative approach there at our office. You know, we've got medical and alternative
So you have medical doctor?
We do. Practitioners from all different backgrounds, allied health professionals, all working together with this integrative approach, you know, to be able to express true health and vitality for these patients to achieve their goals of, you know, overall health.
Okay, now your role at the center is what? Because you speak on the topic.
I do, yeah. And we teach classes there at the office. We do full consultations. I'm working with the patients, so I'm really overseeing everything that's going on to help these patients get to their true end, goal of health.
Do you see reversals in type 2 diabetes?
Absolutely. I mean, this is what we do in our office.
Okay.
And if you look at all of the new research out there, Dr. Julian Whitaker, the Institute of Functional Medicine, I mean, they're all showing and proving that diabetes is completely 100% reversible.
Do you see reversals, people that were taking insulin and now they're off insulin?
Absolutely.
I mean, even at that level?
Yeah, absolutely, Randy. I mean, I can give you a great example. I was working with a patient a few months ago. When he first came in, he was taking about 50 units of insulin a day, and he was wanting to get off of the insulin. He saw that it was starting to destroy his life, and the units were just going up and up and up every single time he was going into his doctors. So that was one of his goals, was to get off of the insulin. He wasn't exactly sure if that was possible.
Okay.
So he came to us, working with him for a few months now, and he is completely off of his insulin.
Off of insulin.
Completely off of his insulin. I mean, you should see how much he has changed, not only being off of the insulin, but all of the other things have improved. His energy level is up. He's lost weight without the need of extreme exercise or, low-calorie dieting or any of those things. He's just overall rebalancing the systems in his own body so his own body can, utilize the own insulin he's making.
Okay, so who is the typical patient then that comes to see you for type 2 diabetes, for it to be turned around? I mean, is it the person that's been told they're pre-diabetic, people with early symptoms?
I mean, we see the whole range, of course. People who have just been diagnosed with type 2 diabetes. We see the more advanced type 2 diabetics who have every complication there in the book. I mean, we see anyone who this condition is affecting. So, with elevated hemoglobin A1C, high blood sugar numbers, they don't have the ability to control it through diet.
So what are the symptoms, by the way? Okay, the early symptoms and the advanced symptoms.
Sure. I mean, there are hundreds of symptoms really out there that diabetics are suffering from. Some of the more common ones include fatigue. That's one that I think almost every diabetic is being affected by. So fatigue is being a low level of energy, that lethargic feeling, that unusual sleepiness where they can't get through the day like they used to be able to. They're having midday naps or crash periods where they may have an event or do something with a family member and need this recovery period afterwards to get through it. So you see their family members are also starting to notice these changes too, because maybe they're not able to keep up with their chores at home like they could, or the housework or the yard work. Sometimes they're not able to keep up with things at work. So their coworkers start noticing changes. And this is, becoming an issue. Patients are starting to worry about, their jobs.
And we were talking in the green room over there, and you were saying that about half of your patients, or a large number of patients, are thin people. They're not just all overweight type 2 diabetics. Is that true? Is that right?
Absolutely. It is a common misconception that weight gain causes diabetes. A lot of times the weight gain is actually a symptom or a complication of the diabetes itself. These people think that, they gained weight so they became diabetic. Usually they became diabetic and gained weight, but they didn't know that they had diabetes in the first place.
Okay.
Because there's, like you said, about 30% of our patients are thin diabetics. Yeah, because there's other issues going on. It's not just the obesity factor. Of course, that's one of them. But it's more to it than that. Because weight gain, it can be a very common symptom or complication of the diabetes. But beyond that too, patients are not sleeping very well at night. They're getting up multiple times to go to the bathroom throughout the day as well.
All right.
So that disrupted sleep also affecting that energy level, which we were just talking about. But also it can make them on edge or irritable or feeling moody, because of that, or it can lead to depression.
Then tell me this, with how is diabetes type 2? Traditionally,
Sure.
Okay, so somebody has been told, you're pre-diabetic. How does traditional medicine handle this, and how does it differ with how you handle it, or treat it, or approach it?
Sure. So let me give you, first of all, that traditional scenario, what I see most of my patients coming in with dealing frustrated with.
Okay.
They're saying, I keep going to the doctor, I've been going to the doctor, every few months, and they're testing my blood labs, and they're giving me more and more and more medications. So these patients now are on multiple blood sugar medications, and after a while, being on multiple meds, blood sugar is still elevated. That's when the doctor will put them on insulin. And that's really when we start seeing those things spiraling downhill, like we started talking about earlier.
Isn't it an insulin problem? I mean, isn't that why they take, insulin in the first place? Not enough insulin?
Well, I can go on and on and on about this, Randy, and draw you out graphs and get the whole physiology of the whole thing. But I'm just going to tell you that is the old belief that once the pancreas cannot produce enough insulin anymore, then it's not going to be able to revive itself to produce that insulin again. However, it's not the insulin production that's the issue for these type 2 diabetics. In the most case, it's the insulin resistance. They found that, the average human, average American, healthy American is producing about 31 units of insulin a day. Okay. In a type 2 diabetic, they found they're producing up to 114 units of insulin a day.
Is that right?
So
on their own?
On their own. On the most cases, they're producing more than enough. Their body's just not utilizing it in the way that it should. So insulin essentially, it acts like a key, okay, to get sugar out of the blood into the cell. So what's happening in these patients, these type 2 diabetics, is that insulin resistance. So those keyholes are jammed. They can't get the insulin, the insulin can't get the sugar out of the blood into the cells anymore.
Okay. And nobody would disagree with this part, by the way? I mean, the experts watching this would say, okay, she's got it right there.
Right,
Is
absolutely.
that right?
I mean,
Okay.
if you look at all the research that's being done now, this new research is of course proving over and over and over again these patients are producing the insulin that their body needs.
So it's a resistance problem,
Exactly.
insulin resistance.
Exactly.
Okay. But back to the traditional approach. Okay, so somebody has been told they have type 2 diabetes. What's normally done?
Well, at that
beginning.
point, like I said, they're put on multiple oral medications. After a while, the blood sugar continuing to climb. The patient is feeling worse and worse and worse. Their fatigue is starting to worsen. Weight gain increases, especially when they're put on insulin.
Is
By
that
the
right?
way,
Okay.
yeah, insulin is a fat-storing hormone. So the more you put into your body, the more weight that is going to be put on. And I'm sure you understand any excess weight is not going to help the disease process. That's just going to perpetuate it and make it worse, which is another way that insulin is really starting to, cause the whole thing to go downhill for these patients.
Okay.
So then from there, they get discouraged with their health because they're doing all the things that they're told to do.
Are they being told they have to be on insulin forever?
Of course. Yeah, once you put on it, you see the dosage increasing continuously. I mean, once you're put on insulin, the majority of patients are not remaining on that certain amount as they remain a diabetic. The numbers are always going up. They'll start.
So it's more and more insulin, is that correct?
Yeah, I mean, patients,
Okay.
they'll come in, they'd start on a low dose of insulin, maybe 5-10 units a day. And then after time goes by, they're going to need more and more and more as the body essentially accommodates to it almost. We've had patients come into our office on as much as 300 units of insulin a day.
Okay.
Okay, that's an extreme
Is that
amount of
large?
insulin.
Okay.
Yeah, it sure is.
And how soon can they get off? I mean, in a perfect world, what are some of the best scenarios? A week later?
Sure, in a perfect world, we've had some patients who are completely off of their insulin in a week's time.
Okay.
Of course, everyone's different. Sometimes it can take a week, sometimes between 6 and 8 weeks. But if you talk to these patients, 6 and 8 weeks is just a small time frame when you're looking at the grand scheme of things and how many years that they've actually suffered with this condition.
Anticipating you coming today, you're not alone with this approach. I did some research on this, and there's books on reversing diabetes. There are medical experts, major universities that believe it's 100% reversible.
Right.
But I guess the big thing is, and if you're tuning in, we're talking about reversing diabetes, some of the new approaches, and Integrative Health of Philadelphia. This is one of the centers you could go to, and you help people get off their insulin and reverse their diabetes symptoms.
Right, of course.
Is that right?
Yeah, and
Okay.
I want to go back to something that you said, Randy, that it's a belief that they can get off their insulin, that diabetes is a reversible condition. It's more than a belief at this
Okay.
point. When we're seeing it day in, day
So
out in our
science
office.
is there.
Right, absolutely. And what's happening not only in our office, in other clinics, and like you said, in the research that's now being done, it's fact. Diabetes, type 2 diabetes, they've proven is a reversible condition.
Okay. And so the type 2 diabetics that are watching this, what are the frequently asked questions? What do they want to know? And, what do they ask you? Because you also do meetings, right? Where people will go either on a one-on-one consultation or you'll meet a group.
Sure.
What do they want to know? And what are they skeptical about?
Well, a lot of them have tried a lot of different things in the past. You know, they have done the special diets. I mean, if you ever go to the internet and type in diabetic diet, I don't know if you ever tried that, Randy, but you'll see pages upon pages come up of, I mean, I've seen everything out there. The protein-only diabetic diet or the vegetarian diabetic diet, right? How more opposite can you get in a diet for the same condition?
So what's the answer?
I mean, well, the answer is whatever is necessary for that specific patient. All those things are out there because they've worked for somebody.
Okay.
Bottom line is that they're not all going to work for everybody. You know, so this is why we need to address that patient as an individual, how their body is working.
And you put them on an anti-inflammatory diet, but is it tolerable? I mean, could they do it?
Of course, you've got to have, as long as they have the motivation and that willpower to get well, if they're truly committed to their health and ready to do whatever it's going to take to get well, of course they can do it. Okay. This is what we see in our office with those patients who want to get well. Bottom line is they have to want to get well just as much as I want them to. Right, with achieving any goal, I can't want it more for them than they do for themselves.
All right, okay, we're going to take a quick break, but before we do, how does somebody get started? I mean, what's the best entry level to find out more about your program?
Well, of course, they can go online to our website, they can call the office to get more information, and I think just really understanding more about the condition and doing the research to understand that this is a completely reversible condition if they've got that willpower and that motivation.
Do you see it every week? I mean, you see a lot of patients. I mean, do you see it every single week in your practice? Where
Of course we do. This is why I go to my office every day with a smile on my face and leave with that same smile. I mean, there's nothing more enjoyable for me or anyone working in our office to see our patients actually getting well, achieving, you know, the goals that they do, really being able to turn their lives around.
We'll take a quick break. Up next, more about the specifics. I want to nail you down on the specifics of diet, the supplements, the testing you're doing, and things like that. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, reversing type 2 diabetes. My first guest here says it can be done, Dr. Carter. Okay, so type 2 diabetes, for people just tuning in, you see reversals every day, every week in your practice.
Of course we do. Yeah, I mean, this is what we're looking to achieve for all of our patients who come in to help them, you know, become non-diabetic there in the end.
And you say you see people, I mean, it's life-changing. Tell me what you mean by that.
It is. I mean, you understand, Randy, when these patients come in, when they're suffering with type 2 diabetes, it is affecting not only them physically, it's affecting them emotionally, and it's interfering with other aspects of their life. So, you know, they're seeing, you know, their work's being interfered with, or their family life. You know, they're not able to keep up with the day-to-day routine that they were, you know, just a few years ago, whenever it was before they were diagnosed or starting to suffer with these different symptoms. So, for example, we're seeing these patients, you know, who were used to going out playing golf a few times a week. Now, when they're dealing with the diabetes, if they've got neuropathies or they're fatigued, they aren't able to keep up with that hobby of golf, which was something that they truly enjoyed doing. And then at the end, when we can get them to go back and playing golf again, you know, this is changing them because they're able to do what they love again. Or we're seeing, I'm going to tell you that I get a lot of cards that say, "Thank you for giving me my wife back." You know, "Thank you for giving me my dad back." Because these patients are able to be who they were before they had diabetes. Because this is a life-changing condition. And it's a highly individualized condition too, which is why we do what we do in being able to identify the true cause of the problem and really get down to that in order for the whole condition to reverse.
And the people that come to you, you say they have type 2 diabetes, but they also usually have a lot of other things going on.
Of course, diabetes leads to a lot of other complications. I mean, it can lead to involvement with the kidneys, kidney dysfunction, liver dysfunction, cardiovascular issues, neuropathies, of course, is another very common complication of diabetes. So these patients are suffering with multiple conditions, but we look at the patient as a whole.
Okay,
you know,
so
we don't just address
let's begin
the list
there.
of
Your approach to diabetes.
So first of all, we understand each patient. So we sit down, we talk with them. We understand their story. How did they get to the place that they are here today? That's step one. Okay. And if we're gonna help these patients get to their goal of health, we gotta know what we're aiming at too. Okay. So we'll discuss those things with the patient, and then we do some testing to understand the underlying cause of the problem. A lot of people have maybe never thought about what the cause of diabetes could be, but it could be dysfunction within, a few different organ systems in the body that are controlling the blood sugar. That could be between the nervous system, the pancreas. A lot of people are familiar with that. Remember, the pancreas is the problem for a type 1 diabetic, rarely the issue for a type 2, but also the liver, the thyroid, the adrenal glands, hormones, digestive system. We look to those different areas that are contributing to blood sugar control, understand where the problem is for that specific patient, and that's what's addressed in order to get them, well.
Okay, so the testing, some of the testing you may do on day one. So you're doing blood work.
Yeah, well, it's different for everybody. Again, that's why first step is sitting down and understanding that specific patient. So it's individualized, whatever that patient needs. It could be blood work, it could be saliva testing, it could be stool analysis, it could be food intolerance testing. It really depends what is ever necessary for that specific patient in order to understand their cause.
And your program is what, a 4-month program to 6-month program, is that correct?
Yeah, exactly. Again, it depends on that patient and exactly what's going on in order for us to be able to determine what it's going to take to get them to that end.
Now, I'm not trying to put disclaimers all over this, like results not typical, things like that, but are you convinced, in your own mind, in your opinion, that if they have type 2 diabetes, they give you 4 to 6 months and you're going to reverse it?
Right.
Are you convinced of that?
Of course I'm not convinced of that. I know that. This is what we see day in, day out. I mean, if that patient has that motivation, if they can match my motivation for them to get well, then we'll get there. It's a team approach. We've got to work together.
My uncle, I told him, I've got these people, he has type 2 diabetes, and he's physically in good shape, but he has type 2 diabetes and he's taking insulin. And I talked to him time to time, and I told him about this. He said, Randy, I'm telling you, my medical doctor says don't believe that stuff. It's quackery. It's just not true. Do you get that a lot, by the way?
Of course.
Because I know you have a medical doctor that's working there that believes it's reversible.
Right.
But do you get that, like what my uncle told me?
I mean, I'm going to tell you that a lot of my frustration there comes from my grandfather had type 2 diabetes, and I watched him, go through this condition and being told, there's nothing that can be done, continue on the insulin, and just watched him get worse and worse and worse. From there, that's what initially sparked my interest, saying, okay, there's got to be something that can be done about this condition to turn it around, to help these patients not continue down this one-way street, which is what a lot of patients are being told at this point, that it's a progressive degenerative disease. Once you have it for the rest of your life. And it's just going to continue to get worse in the end. However, what we're doing is completely changing that. It's no longer a one-way street. Okay, these patients can stop, turn around, and start going the other direction. If they've got that commitment to their health to get there, and they will. So
back to your testing a little bit. You talk in terms of identifying the trigger and then eliminating the trigger. What do you mean by that?
Yeah, well, when you use that word trigger, it's really understanding the cause of the diabetes. What's that underlying dysfunction that's creating the blood sugar to not be controlled throughout that patient's body? So once we have those answers as to what it may be.
And what is it usually? What is it usually?
Well, I'm going to tell you over 80% of the time, adrenal dysfunction is the primary cause.
Is that right?
Yeah, the adrenals, I don't know if you're familiar with them. They're 2 glands, that actually sit atop the kidneys. They're controlling some really important hormones and functions throughout the body, which are directly impacting the blood sugar. They're commonly called the stress glands of the body.
Okay.
And here in America, pretty much everyone's dealing with stress, chronic emotional or physical stress. And when that's occurring day in, day out, these glands get fatigued. They can't function appropriately, so the blood sugar is affected. But beyond...
So they have adrenal fatigue.
Yeah, exactly.
In about 80% of the cases.
Right, well, I'm going to say...
And you heal the adrenals? You help them with their adrenal?
Exactly. We give the adrenals the tools that they need to be able to perform on their own.
Okay.
So, a lot of people think, well, why don't I know what the adrenals are? Why have my adrenals not been tested before? Well, it's not a standard test. It doesn't address the symptoms, it addresses the cause. Right now we know that the majority of conventional treatment is aimed at the symptoms of diabetes or the end result. It's not addressing the cause. So why would they test for something that is not going to change the treatment regimen?
Okay.
But of course, what we're doing here is identifying that cause. Because I told you 80%, that's the primary. The other 20% of the time, if they're not the primary cause, they're at least involved. I'm going to tell you, I've yet to see a diabetic who has perfect functioning adrenal glands. It just doesn't happen.
Okay, so you help those out by doing what?
Well, a specific supplementation or nutritional changes, and it could be stress management, whatever it may be, lifestyle changes to, like I said, have that own patient's body doing the own job that it's meant to do. So we give it the tools that it needs to be able to perform.
How soon do they start feeling better on your diabetes program?
Some patients, it could be immediate. You know, those types of results could being that the energy level is going up, or they don't need a midday nap, or they're not having that crash period anymore.
Do they come in there, your patients, and they say, oh, I'm able to do this, I'm able to do that? I mean, do they do that?
Absolutely, absolutely, and they love to. They'll bring their family members and say, tell them what I can do today. You know, I've had kids come in, with their mom saying, Mom, could take me shopping again. And it may seem small, but
interesting.
Yeah, it's because that they weren't able to do these things before, or they're able to, like I was saying before, be able to go out and play golf, or swim, or exercise, because their doctor tells them, oh, you need to exercise more, but they don't have the energy level to be able to exercise. So now the energy level goes up, they can start exercising again. And we're also seeing that simple things. Okay, I'll tell you, a patient came in once. She said, Doc, by the end of the week, she's working in a school. She said, by the end of the week, I just crash. The weekends, I just do nothing. She said, even taking a shower during the weekends is becoming a huge task. So anyway, when she came in saying, I can shower on the weekends now, that was a huge improvement. She was able to do cooking and cleaning. So these patients, like I said, not only increasing their energy level, they're sleeping better at night, no longer getting up and down throughout the night to go to the bathroom.
Okay.
Also, neuropathies improve. So, this is, of course, can be also life altering for these patients. Areas of their body they thought they'd never be able to feel again. Then, sometimes they'll get a tingling sensation first. Then they have full function, full feeling back to these areas. I mean, a patient told me once he was sitting up watching TV, and he was watching his grandchild, and then all of a sudden he starts laughing. I said, oh, okay, well, what was that laugh about? He said, well, his grandchild was tickling his foot with a feather. He said, I was laughing not only because it tickled, but because I could actually feel it.
Is that right?
Yeah, so we see this, of course,
so people that have type 2 diabetes, they have red swelling on their ankles sometimes, or different problems. Do you see those also going away?
Of course, when there's perfusion issues like that, as the body is overall balanced and working appropriately, we restore that function. Yeah, those types of swelling or diabetic ulcers or slow healing time, they also improve. I mean, that also, bowel and digestive function restores back to normal as well. And overall, the patient feels better. Emotionally, when you physically feel better, that's going to affect the emotional health too. So the mood becomes more even. They feel less irritable.
So you've seen people, though, 20 years on insulin. Mm-hmm. At that point, they're not too far gone.
No, really? Absolutely not. I mean, there's no place where you need to give up hope. For these patients, they need to realize that if they want to get well and they're willing to do what it's going to take, we can get them there. So we've seen patients who have been on insulin for 20 years, had their dosage constantly increasing to the amount that they're on that 100, 300 units a day.
So they have to prick their fingers, I guess, measure blood sugar throughout the day.
Does that go away too? Yeah, Randy, let me go through with you basically what a typical diabetic is going through on a day-to-day basis. So first of all, they're waking up tired because they didn't sleep very well throughout the night, getting up multiple times to go to the bathroom. So they wake up tired, they have to prick their finger first thing in the morning to get that fasting blood sugar level that their doctor, their endocrinologist, whoever it be, may be recommending that they keep track of.
Interesting, okay.
So, and then from there, they have to take their oral medications or their insulin, whatever it may be, and then they're constantly thinking about food. What can I eat? What can I eat? How do I eat it? What's right for me? Is this going to affect my blood sugar? I mean, it's constantly on their mind. It's one thing that is consuming them.
Did they tell you this? Did they tell you this?
Yeah, of course they do. It's something that some of them have been dealing with for 20, 30 years, or especially if it's a new thing, they don't yet understand. They've been told that they need to eat right, but not told exactly what's right for them. Because like we were talking about before, all those different diabetics diet out there, it can be confusing. So they need to understand exactly what is right for them, so they're always thinking about it. So then from there, maybe they push themselves to get some housework done or go to work.
So they feel lousy.
And, yeah, they're not feeling good, like I said, from the moment that they wake up. All right, then they, maybe, like I said, get some housework done, do some work, come home, and then they've got to have that nap because they just crashed. They're done. They're spent. Okay, so then they wake up from that. Then they have to, again, think about, oh, what should I be eating? And then they've got to prick their finger again, get their blood sugar throughout the day, take their medications, and then they're ready for bed at that point. And these patients, they'll tell me, I feel like I'm just existing.
It's just hard to believe, though, that that's turned around with nutrition and supplements and the different protocols you're putting people on.
Right. I mean, it's to the point where we can get these patients back where they feel like they're living again. They're not just existing. They're not just going through the motions. They can think about...
So they say that. I just feel like I'm existing.
Yeah, the biggest goal that my patients will tell me is, Doc, I just want to be me again.
Okay.
I want to be me. I want to be who I was before. I want to be the spouse that my husband, my wife fell in love with. I want to be the me that is there for my kids, to be able to see them grow up, see my grandkids grow up. and be able to be there for every step of the way. So to be able to have them get back to that, there's nothing more rewarding.
And this is a big topic. I guess we could talk for a long time, like you say, because
we
you say
could go
you're
on and
healing
on and on.
the adrenals. You say you're dealing with intestinal health or gut health, food sensitivities,
right. Well,
diet,
like I said,
supplements.
really, basically, let me just tell you, of course, it's first step, understanding the patient, getting a complete, thorough history on the patient, what they've been through, how they've been treated, exactly what they have going on right now, understanding their story, their diabetic story. Then from there, we do individualized specific testing to uncover those underlying causes of the unregulated blood sugar. Then from there, that's what's specifically addressed. So initially, you may need to go through a digestive repair, an anti-inflammatory process in order to have essentially a stable internal environment to be able to work with. And then once we have those answers of whatever the underlying cause is for that specific patient, because remember it's different every time, that's what's specifically targeted through the use of specific nutritional changes or whether it's dietary, supplementation, lifestyle modifications, whatever is required for that patient in order to get them.
So you lay it all out for them. I mean, it's in writing.
Exactly. I mean, this is, I think, one of the main things that patients are getting lost with out there, is that they're confused as to what to do, where to go to, what is best for them specifically. Because like we were talking about before, there's all of these different, protocols or programs or whatever you want to call it, and they may be right for somebody, but they're not best for everybody. This is a very individualized approach to diabetes. A lot of people don't realize, but diabetes is an individualized condition. So we lay it out, we give them very clear guidance as to what is best for them, whether it's dietary, lifestyle modifications, whatever it may be, so that way it's very, it's easy for them. Once they have it all right there in front of them, they know what to do, and it's no longer consuming them on a day in, day out basis. I know that big question mark as to how do I get well? So
we're out of time. But somebody watching this, they want to know more, they want to get started. Where does it begin?
Well, they can go to the website, they can give us a call and really come to the office so we can have a full consultation so you can understand if it really is a good fit for them.
So you have a free consultation. They could go in, ask questions, figure out whether
they can really understand more about exactly what we do, and that from that point on we can move forward to do the individualized testing as whatever's best for them. Okay, good. Thanks again. Very interesting stuff. Thanks. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, you can visit our website at wellnesshour.com. Just put in diabetes or Dr. Carter. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.